My understanding is that social workers help families when they can't figure out how to get the resources and the needs they have to meet the family needs, like housing and food and clothing and all those things that we need to make us feel safe and comfortable.
Okay, and then I know that you all work with them as well, so do you mind just explaining, giving some examples of what they do for you all?
Sure, we partner with agencies like CPS and schools, and they have social workers that help kids. We have kids that come to us with all kinds of needs. Maybe they don't have enough food in the home, maybe they don't have enough childcare, maybe they don't have a place to live, or maybe they don't have a bed to sleep on. So when they have these needs, we partner with social workers who help them find the things that they need.
Okay, thank you. And so why is there a need, or why do we need social workers in DeWeese, Texas?
Well, we really need those experts who know where those resources are and can find them and know how to find the people to talk to and the agencies to work with and just where to reach deep into the areas of help to meet the need, to match the need with the resource.
Right. And so are there any success stories you would like to share, any examples of working with social workers that you may have?
Yeah, we love partnering with the social workers in CPS and in the schools. And so when children come to us and they've had a moment where they didn't have enough clothes, for instance, maybe it's winter and they need coats, we've been able to have social workers who help with that, or we partner with them when we give them the resources that we have who people donate to us, and we can help sometimes with the kids in schools who have a need or the kids in CPS who have a need. And we've been able to partner with them and give them those resources.
Okay, thank you. And then one other thing I was just going to ask is regarding, I know for this month when it comes to social workers, it's about empowering them, and part of it also explains that there is also a need for mental health service providers as well. Do you know or have any information regarding that?
I think there's never enough resources when it comes to mental health services. We do have a counselor here on staff. She is very busy. We do refer out to partner offices that have trauma-focused counseling, but there's never enough trauma mental health services available. Burke, of course, is a wonderful resource that we have here locally that serves several counties. But it just seems like there's never quite enough of those services. So people going into the LPC field, the licensed professional counselor field, people going into mental health, we need our local students who are interested in those fields to look at going into the mental health fields and to look at working here in rural East Texas.
Okay, thank you. And is there anything else you'd like to add regarding social workers or this month in general?
I'd just like to thank the social workers that help the kids that we work with. We work with children who are suffering physical and sexual abuse or who've witnessed major crimes. And social workers are people who help us come alongside these families when they need help, and we appreciate them so much for what they do.